So the first speaker is Dr. Rajeena Shahin, who is the founder and CEO of Invest on Health, which is a healthcare tech company. And she has been a strong advocate of lifestyle medicine as a first approach to chronic lifestyle diseases. And she had her MBBS from TD Medical College, Alapi. She was my senior. And then she moved on to Bangalore. She then completed a course in clinical research, joined pharma and nutraceutical company as the clinical head of their CRO. She has also completed PGDM from the Bharathidasan University in Trichy. Her pharma experience was majorly in clinical trials of chronic lifestyle diseases, which led her to further research in the subject in detail. And from 2010, she's been practicing lifestyle interventions for the management of chronic diseases. Very interesting. She took an interest in this as her husband in his early 30s developed metabolic syndrome. And you can see the Facebook pictures of Dr. Rajeena and her husband, how they are maintaining their healthy lifestyle. And in 2015, she founded Invest on Health with her ex-husband and running the same from then on. IOH provides comprehensive lifestyle intervention services to people suffering from chronic lifestyle diseases, and the company has already touched thousands of people with chronic lifestyle diseases. So with this, I would like to hand over the session to Dr. Rajeena to start her lecture. I am transferring the speaker rights to you, Dr. Rajeena.
Hi, Dr. Prashant. Thank you for the introduction. I think you covered most of the topics. Yeah. And Dr. Vijay Kumar, I'm very happy that somebody in the group already knows about lifestyle medicine and Dr. Ornish, and you've already read his book. He's also one of my group. He's also a Facebook friend of mine. Sometimes I pass some messages and things like that. Something to clear doubts or something like that. And, it's a wonderful topic to be discussed in today's era. I mean, especially with COVID, a lot of attention has gone into the picture with respect to infectious diseases. But NCDs, still we have we haven't addressed NCD till now. We are actually like lifestyle medicine is a way forward to address the issues with respect to the NCDs. Okay, let me open the slide. Actually, I will have to 1 second. Yeah, 1 second. I think I know how to open it. Yes. 1 second. Can everybody see this now?
Yes. Yeah.
Okay. Yeah. Okay. Before coming into lifestyle medicine as a specialty or to address NCDs, non-communicable diseases, let me take you through what is lifestyle. But basically, lifestyle is actually a conscious decision to take or choose something, a particular behavior over another. For example, whether to eat, red meat every day, or to drink alcohol every day, or to smoke or not to smoke, which has a huge significance or huge effect on the way our health is formed. Basically, genetic expressions, inflammations, oxidative stress, metabolic dysfunction, multiple aspects it affects actually, but we normally do not know. Right now, actually, if you look at the Kerala scenario itself, if you look at the urban Kerala scenario, you see, we have a lot of clients from that area where people normally put their, plates into our app, actually, into our backend of the system. You can see a lot of difference the way I used to see maybe 15, 18 years ago. And right now, there are a lot of junk food, junk stuff, a lot of red meat, a lot of fried items, which was not there before. Right now, actually, also the Thorin and BL, those kind of things has gone out of the picture, actually. So these kind of things is not shaped by your own, decisions, but it's also shaped by the kind of culture which forms around it, actually. So let me also take you through why, a little bit of science of epigenetics. We all know that now DNA is not our destiny. It is actually the epigenetics, which is which determines whether you develop a disease or not. Epigenetic, we all know that, actually. Genetic makeup is there. On top of it, there is chromatin, this thing, epigenetics, which determines whether a gene has to be knocked off or knocked in. Okay, for example, we always say that your genes are loaded gun. Your genes have multiple, predisposition to multiple diseases. But to knock off that gene or to knock down that gene, there are some chemical reactions like methylation, demethylation, these kind of activities happens, and decide whether you need to express that gene and show the disease or not to show the disease. Looking at the picture itself, you will understand how that whole process happens. Actually, like somebody with a predisposition to an obese phenotype, the obesity, keep on eating those kind of junk food and physically inactive, he will develop metabolic disorders. But whereas a lean phenotype, who's eating majorly into a plant-based eating pattern will actually kind of cut down the risk for these kind of diseases. We also know that, it's also a lot of things has been validated, especially with the risk factor or the tumor suppression effect of physical activity, and also the folate in association with colonic cancer. Consumption of phytonutrients from fruits and vegetables is associated with the prevention of multiple chronic diseases, including cancer. We all know these kind of things, but we are not actually incorporating these changes into our lifestyles. Actually, that's where lifestyle medicine comes into the picture. Let me also take you through why I was so convinced with this kind of a thing after practicing medicine, getting into clinical research, where I was growing. But, early 30s, when my husband was around 31 or something, one of the days, I was pregnant that time, and he went to pick up my mother-in-law to, she was planning to stay with us for some time. And on the way back, he was like, they called me and told me that he's hospitalized in Baptist. It is near my home. Actually, it's around 10, 15 kilometers from my home. And, the doctor was saying that there's some cardiac problem. His BP was like 200 by 130 or something. And immediately I rushed to the hospital, and then there was no issue before that, actually. And then we kind of came out of the hospital, and I called up my cousin immediately, who's a cardiologist in Palakkad. So he said, listening to the symptoms and kind of investigations all came out normal. He told us maybe it's claustrophobia, is he sleeping, few things he asked. Then we realized that he was actually not having enough sleep. He was a complete non-veg eater, and he's like highly into junk food, high on meat, especially red meat, dairy, and he was leading a sedentary lifestyle. And 31, he was, then by the time we all the lab reports came, it turned out to be he's having metabolic disorders, actually already setting in. Fatty liver was there, and enzymes were also started getting abnormal. He had to undergo surgery, robotic surgery for renal stones, hyperuricemia, pre-diabetic, multiple things actually, and he was also very upset because, he's only 31. His father passed away at the age of 58 due to heart attack. And the first heart attack for him happened at 52. So this kind of it was an eye opener. He wanted to change the lifestyle, but we didn't have any idea because we never got a chance to think about lifestyle can bring in that kind of a change in people. But somehow we started researching. That was 10 years back. We researched on these kind of things and found out that came to know about Esselstyn, Dr. Esselstyn, Dr. Ornish, and those kind of people, and we started changing the whole lifestyle. And after 10 years, in early 40s, this is his early 40s, the right most, and he was running half marathons actually. So you can understand the kind of transformation it has brought in. Last 10 years, there is no problem with his metabolic parameters, all within normal limits. Now we are actually helping a lot of such people like this. Okay, that's an anecdotal evidence. It's my personal experience, but why I got into lifestyle medicine. And definitely, I also lost some weight, and I got much healthier post-delivery and things like that. That was a part of it. And we went ahead with a predominantly whole food plant-based diet, which is large quantity of vegetables and fruits, and regular physical activity, sleep pattern was taken care of, and all aspects of lifestyle were taken care of. Now, this we already discussed. Why this, this is important in a clinical setup, clinical scenario, or a medical scenario, because we all know that 68% of the global death is attributed to chronic lifestyle diseases. And in India, it is 60%. Maybe recently there would be changes because of the COVID cases, for the corona cases, but on an average, this is the number. So definitely this is something to be addressed. And you can also see this, this is NCD burden of diseases report in 2000. But, there are some changes in 2018, but I couldn't get the slide. But look at the kind of cause for these kind of diseases. Tobacco is definitely still the first one. poor diet and inactivity is the second one, then alcohol and other things. So lifestyle has a huge impact on the way health is formed. And not only about us and our families, but communities and globally, so it's something as physicians, as people who are concerned about the healthcare system has to address altogether. So now we will be thinking, like, already we are treating diabetes with the medications, we are treating hypertension with medications. And then what is lifestyle medicine? Lifestyle medicine, if you look at this picture, you will understand. This is, I've already mentioned, epigenetics. So epigenetic stimuli is coming from either proximal causes or distal causes or medial causes, actually. Any of these kind of stimuli can make a person prone to develop the disease or develop the disease. And what we are doing as clinicians right now is we are actually minimizing the risk factors. But, high blood pressure, we give medications, dyslipidemia, we give statins, glucose, we manage it, hypoglycemia, we manage with multiple medications. We are not addressing the causes of the disease. So there this lifestyle medicine comes. What lifestyle medicine does is actually we are addressing the root cause of the disease by multiple interventions. Actually, like in a clinical setup, if you look at your own practice, you would be addressing your patient with the diabetes to go and reduce weight and do some physical activity. That's very generic, superficial advice you're giving to a patient. And the patient is clueless how to go ahead with it, because we get only 15 minutes with the patient. We're not able to give enough time for him to explain how it is to be done. And sometimes, most of the cases, nutrition and physical activity, those kind of lifestyle related knowledge, we are lacking, actually. Those are the areas which, as clinicians, we need to improve on. So how to do that? So that's why lifestyle medicine has come into the picture, right? Lifestyle medicine started as a organization in the US in early 2000s, and it is called American College of Lifestyle Medicine. Now, actually, it's now 3,500 members are there. Every year they have exams. 2017 they started with exams, board certification. Now, India, we have something called Indian Society of Lifestyle Medicine. I'm also an active participant in the groups and things like that, and we have the executive body for that, who decides a lot of things regarding exams and other activities and all. So what is lifestyle medicine? Lifestyle medicine is actually an evidence-based medicine. So that's when you look at these sampling guidelines that incorporate lifestyle recommendation for chronic diseases, which is done by AHA, American Heart Association, ACC, and a few other bodies, you can see that everywhere lifestyle intervention is mentioned. But the exact pathway, how it is to be done is evolved over the last 20 years or so. One of the major pioneers of lifestyle medicine is Dr. Ornish, Dean Ornish, which Dr. Vijay Kumar has already mentioned. And there are many of them, like Dr. S.L. Steen, T. Colin Campbell. Many of them came together, put together different modalities how to address these issues, actually. So as I told, it's not easy to address behavioral pattern of people, change them for, managing their conditions. It's very easy to give a pill, actually. So it is something which requires a multidisciplinary approach majority of the cases. And also I'm taking you through some of these lifestyle studies, evidence-based studies, to make you understand that it's not something a fake science or a fad science. It is evidence-based, actually. It is. So you must have already gone through this nurses health study, which Dr. Vijay Kumar would be aware of it. So it was done in, I think, 16,000 something healthcare professionals, and it shows that 80% of the heart disease and over 91% of all diabetes in women could be eliminated if they adopt a cluster of positive lifestyle practices. And this slide must be familiar to many of you, the relative risk for diabetes according to BMI. So that slide is taken from the nurses health study. And this part, everybody is clear. Anybody comes with that diabetes, any diabetologist or any physician will advise them to reduce weight or to do physical activity. These two are normally addressed. But how they do it is not able to address because of the time constraints or the lack of awareness, or, patient will not listen, these kind of multiple issues. Another study which is done in 2017 by Dr. Sarathi and his colleagues in Asian youth, actually. This is very important. The type 2 diabetes mellitus early diagnosed people, intensive lifestyle intervention therapy alone or in combination with metformin, when HbA1c was more than 9%, could achieve reversal or partial remission of diabetes within 3 months, actually. This is something which is very relevant to our context. You also must be noticing that people, even though they're not obese, their BMI must be like 25 in the global standard, but still they'll have a belly, actually, where we call it central adiposity, which also makes them prone for developing diabetes or other metabolic conditions. Another one is National Diabetes Prevention Program, DPP, and actually it's an ongoing study. 22 years later, the new report came. The kind of prevention or the suppression or the kind of continued effect on these lifestyle interventions on preventing these diseases is still actually applicable even after 22 years. So that's what it shows. And then dietary cholesterol, this also is one study, actually, that was in 2014. Consumption of a cholesterol-lowering dietary portfolio, including plant-based tea rolls, viscous fiber, soy proteins, 6 months. That improved blood lipid profile. This we always see, actually, we always, when somebody comes with a high cholesterol, LDL, especially higher LDL, we always look for their saturated fat containing food portions in their diet, especially the ones with, red meat and coconut oil, ghee, butter, those kind of things. Once you cut down those, definitely their cholesterol level comes down. Actually, that's what I'm saying. This is science. This is not some kind of a fad concept and ideology which somebody is going to promote. There is, there are a lot of allied field which comes together, like veganism and multiple things, to promote the overall movement so that the whole thing will reach out to more people. Then, coming to how to practice lifestyle medicine, all these things are true. There is science behind it. Like nutrition is nothing, food is nothing but chemicals, which has an impact on our body. But how do you practice lifestyle medicine? Because, you ask a person to increase your exercise pattern, reduce the kind of food they are eating. It's not easy to bring about, actually. Like the first thing is we need to bring about the changes in our own life, actually. Like as Dr. Vijaykumar said, every physician should be an inspiration to his patients, his community, his family, so that people feel that, oh, I want to be like him or her, so that I can be staying healthy, be vibrant, and prevent all the diseases. That's first thing, actually. Be a role model yourself, then your family, then to the community, reach out to the community. And when you're thinking about that, then how is it going to be effective in a clinical practice? When you're thinking about clinical practice, as I mentioned, many cases a multidisciplinary approach is required, because lifestyle physicians normally give a generic recommendations and coachings and things like that. But many cases a behavioral therapist approach is required, because bringing out these changes is not very easy in all cases. Actually, 80% of the cases may respond well, but the other cases may require these kind of interventions, actually. And physical fitness expert, actually, like if you're not very clear with the guidelines and other things related to the physical activity, it's better to get a somebody who can collaborate with you to help. In case none of these things are available, a physician himself can develop these knowledges to kind of guide people on a basic scale, actually. How to do that? Okay, so when you're thinking about a lifestyle change, it's not about just diet, it's not about just exercise. It's a combination of these factors working, these kind of factors or these kind of habits working at a level where it is at an optimal level, which is giving you the eternal health or the optimal health. It's not like something like some people will come and say, okay, I'm actually very much a vegetarian, I don't eat anything, I'm very healthy eater. That's one component of it, actually, that he's completely a sedentary activity person, he's smoking. So it's like not like one aspect of it. As Dr. Vijaykumar said, stress is as much as part of lifestyle as the diet is, actually. Like somebody, you must be, everybody aware of that 42-year-old CEO died, actually, who was in the physical activity, who was eating well. What was the reason? His reason for his death was stress and sleep deprivation. So all these aspects should be working at an optimal level. So how to do that, actually? How to do that is actually like, I just put something which we can share at a later stage. And, normally when you are thinking about a dietary adaptation to lose weight, you will have to plan a calorie restriction. But this somebody with a 90 kg or something who is needing around 2,400 calorie, when that person goes through a weight loss thing, it's not just about the weight loss which is going to bring in the result. It is the overall thing I've already mentioned. But for weight loss, we need to create a calorie deficit. So this calorie deficit is normally created with the help of dietary restriction and exercise. So 2,400 calorie person, to maintain his current weight, he needs 2,400. And you give a restriction for 800 calories from diet, another 200 to 300 calories. Let him start doing exercise. Together, you're creating a calorie deficit of 1,000. Once you do that, in 7 days, he will lose, 1 kg. That's very basic funda, but there are some aspect of like lower BMR, like hypothyroidism, multiple other conditions like stress and few other things definitely play a role. But now, coming to the food pattern, I would like to address this issue. Food is something which is, has chemicals which is going and talking to our cells. That cells talking will decide whether you need to be vibrant, active, healthy, or you have to be like very lethargic and, having diseases and things like that. So the only one thing, this sentence I really loved, I got it from one of those lifestyle physicians group. The only thing which you can do wrong with food is oversalt it, oversugar it, overcream it, or overcook it, or fry them to lose all the nutrients. If you're not doing these kind of things, there is very little you can do to ruin your food. That's what we always do in our homes. In our home cooking itself, there are a lot of fried items which we see on a regular basis. And some of these things I'm just rushing through because it's already time. Limit your refined carbs, which is white products, white pasta, white bread, those kind of things. And the ones with the trans fat. Trans fat is like burgers, French fries, the dressing which you use, donuts, all has trans fat actually. And added sugar. Definitely added sugar has to be limited. Then limited saturated fat. Saturated fat, we normally say to limit to 10% or less of calories. A 1,200 calorie person, if somebody is taking 1,200 calorie a day, his total saturated fat should be less than 12 to 13 grams. That's the reason why we avoid coconut oil most of the cases, because coconut oil, 1 tablespoon itself has around 12 grams, so 11 grams of saturated fat. Same with ghee. Ghee has 8 grams per tablespoon. So once we cut down these things, the LDL comes down naturally. 30 to 40% reduction is what we see in 2 months actually, once we cut down these things. And trans fat is definitely a big killer. We all know by now that is 1% of the total calories. So avoiding these kind of issues, things itself will take out that issue. And this is another major concept which I want everybody to learn about, because when you're selecting food, let's be wise about the food we select, not for our taste buds, but for our whole body. It's about the cognition, preventing diseases, anything. So you will have to select food which is energy low, but high nutrient. So micronutrient rich, energy low food, which is majorly vegetables and fruits. You can look at the picture itself and you can make out actually 400 calorie vegetable fills the overall stomach, whereas 400 calorie of oil is just in one corner of it. So you will understand 1 tablespoon of oil is 120 calories. 1 cup of vegetable is only 60 calories. So that itself makes a huge difference. And 1 cup of vegetable will give you tremendous nutrients, micronutrients. Again, the ones like phytonutrients, which has the ability to protect you from diseases. And I'm just taking you to the Canada's plate, which is something which everybody has to start adapting in our life. Every meal, make sure that half of your plate is vegetables and fruits. Vegetables and fruits can be eaten in any form, but avoid juicing it or preserved ones and packaged ones actually, but also overcooking can be avoided, over frying can be avoided, but stir fry it, steam it, salad, any form. So let half of the plate be vegetables and fruit, other half divided into 2. Upper half can be a protein portion, which can be a fish, basically legume-based is much better. Like plant-based proteins like dal, bean, soy products, or fish and chicken, and a lower part is green. Right now, I want to address this 2 minutes because, Kerala, major problem which we face is not about the American diet, standard American diet, where they increase a large quantity of non-veg, red meat. Here we face problems with the large quantity of grains, refined grains. 3/4 of the plate is grain. That has to change, and it has to be 1/4 of the plate. And some of the plate, for your reference, this is a plate which is done by one of my clients, Sopna. She's a Keralite from Middle East. So these kind of things, it's basically like a plate pattern she's trying to make it. Look at the thing, left half of the plate is completely vegetables, the right half divided into two. One is the rice portion, one is fish. That itself shows that how balanced the meal is actually. And now, lifestyle medicine, last slide, is a continuous care system where patients will be in continuous connect with you, actually. They are not just a passive recipient, just like medical, this thing where you go there and give some medication, but they are an active participant. So knowledge level of the clinician is also very important, because they'll be asking a lot of questions, and we'll also have to have enough resources to help them with multiple aspects of lifestyle intervention. And it's not always the intensive lifestyle medicine therapy which is going to be helpful. It's small changes. 50% of the recommendation is able to do that itself will bring in a huge change in the overall system. And a physician who is practicing, or a dietologist who's practicing modern medicine, is advising his client in a small manner to take up his take charge of his lifestyle on a basic level, like giving advice on diet, exercise, and things like that. And he's able to lose weight, and he's able to bring down his diabetes medicines. Definitely will create a huge trust in the patient and the family and the whole system. The whole healthcare system will be much more trustworthy. And we are also able to take care of the really sick ones better. And these people definitely need a guidance from you. The whole healthcare system itself will change the way if we incorporate lifestyle medicine practices into our system. I think that's all for today from me. I think I was like too fast and
Thank you, Dr. Rajeena, for that wonderful exposition of and introduction to lifestyle medicine. Over to you, Vijay sir.
Thank you, Dr. Rajeena, for the nice presentation. Actually, we had two studies on one on yoga, where we gave yoga sessions for 3 months.
Okay.
And at the end of the 3 months, there was a reduction of 30 milligrams of cholesterol.
Excellent.
And 7%, out of 20 patients, 7% could reduce their diabetic medication, and 1% had to could withdraw the medication. And there was also 5 millimeter reduction in diastolic blood pressure, and 10 millimeter reduction in systolic blood pressure at the end of 3 months. 3 months. Maybe because of the yoga alone, maybe because of the dietary changes as advised by the yoga trainer.
Yes, doctor. Definitely, this has a huge impact. The overall thing coming together is what is bringing the result, and yoga has a huge benefit because it's a balanced thing. It is a mind and body connection. It also relaxes a person. It's not just about other type of exercise. Definitely, it has a huge impact.
And also, I'm interested in about your obesity, management of obesity.
Sure.
Actually, that's a very difficult thing. The most difficult thing to manage. I openly said to the patient, the most difficult thing will be to reduce your weight. Because we did a study on 3 patients, 110 kilos. We followed the GM diet. That was the only diet available. 15 days back. GM diet, we gave it for 3 months, but there was 30 kilogram weight loss. Because all of them were highly motivated. Because they were at risk bariatric surgery and also knee replacement. So that is why they followed my diet. And there was reduction, and they maintained it for some more time.
Excellent, doctor.
That is.
Yeah, I think diet, I will share some of the information. Basically, we don't need to go ahead with any of these diet, just calorie restriction, but give the calorie restriction from the diet right ones, where the calorie is coming more. Especially in Kerala scenario, it's a grain portion which is taking the calorie and the gravies. Take out that or reduce that and increase the micronutrient portion. Micronutrient is the vegetables and fruits, actually. That will help. Actually, I'll share some kind of information, especially.
And one more thing about one more interesting part. Maida, actually, that is and parota is a staple for. Actually, it is becoming a very common diet of Keralites at least. And going to literature, I found that alloxan is coming as a byproduct of the process of Maida production. What is your opinion on that? Is it a serious thing to warrant some immediate action?
Doc, actually, I would prefer to address this as a overall thing. Actually, somebody who's taking 3 servings, maybe like 3 maida servings a day, and rest all with fruits and vegetables, large portion of thing coming from the micronutrient portion. It's something which we can ignore. But overall, if somebody is like wanting to be really healthy and want to manage the cholesterol, the overall diabetic profile and obesity and multiple other things, it's better to kind of cut down on the refined carbs. Actually, refined carbs, any form, is something which is going to increase the metabolic risk, irrespective of Alexa or not, actually. So that's something which we should be cutting down, especially the parathas and those kind of things. Actually, that definitely has to go off the plate. But when we manage these things, it is better to go at an incremental fashion. So somebody from a North Kerala who's quite used to eating these parathas and asking them to go off, it will not happen. So address those issues which we can take off or add instantly, so that they will not feel the burden of changing. Actually, so that's what we normally do. But this definitely, anything with saturated fat, trans fat, refined carbs, these things has to be cut down ultimately, actually. And alloxan definitely is something, all the refining process needs to be cut down. And oil definitely is something which I feel that for a person house normally drinks for 2.5 liters of oil a month. Can you believe it? The kind of calories coming from the oil? Something, so we bring it down to around 500 ml.
Or Prashant for any.
Yes, sir. We will.
Questions at the end.
Discussion.